So, without further ado, let's see. We have only 30 minutes, and I have a huge amount of things to cover. I'll see how much I can cover. So, first of all, please everybody open your eyes and be ready to get shocked, completely shocked. Okay, I'll just it was mentioned in the bio. I have been trying to take people through various health transformations through online programs. So this is a graduate of our recent program, 3 month program, and this lady lives in Delhi. And this is the picture on the left is 3 months before, and picture on the right is 3 months after with only online training once 1 hour a week. And this is the change which has happened. She was diabetic. Her sugar has come from 270 to 90. She had gastric bloating, which has gone, cervical pain, which is gone. She used to be intolerant to a lot of foods. It is all gone. And obviously, she looks much, much better. She has lost how many kgs? I think 13 kgs. And she is going on to lose another 12 kgs within the next 3 months. And she knows how to do it. And so this is the other lady. She is from Indore. She is a dance teacher at Delhi College. And with that kind of a exercise routine of 5 hours dancing, she was still very overweight. She on the left side, this is what she was looking at 3 months before. And after 3 months, she has absolutely changed. And she is so enjoying this thing that she is like dancing like with twice the energy. And the third example, you will all be very shocked. You remember these people? Everybody? So these were the go-getters who are from your own group, your own this thing, and you can see the transformation that has happened. And especially, I would think Dr. Wadhwani sir is absolutely right to go into a movie with a fantastic character role. And Smita ji is not going to be left behind. So you can see this is 3 months. And this is the changes which can really, really happen if you know how and if you want to do it. So with this introduction, I thought pictures speak better than words. And I will just go forward and will give you some principles of how we go about doing this. So, and this is the final picture I'm going to show you. These are the Aborigines which are living currently in sub-Saharan Africa who have got no civilization, zero civilization. And these guys are as fit as Dr. Wadhwani here or as the other ladies here. They are not doing any course. They are not going to any gym. They are not doing nothing. But these guys are as fit. So if these guys can be fit, why can't we be fit? So what these guys are doing that we are not doing? And to give you this thing, exercise is not the answer. If any of you think that if you can exercise and lose weight, forget it. You have got to the gym. You have seen so many people exercising day after day, month after month, year after year. Not 1 kg they lose. They remain the same. So exercise is not the answer, right? And this is a final picture I'll show you before I close this presentation here. And this is the motivational triad of the three motivations that are built into us by nature. And I will talk about this very, very shortly. So, so now, how did this happen? How did all this transformation happen? Uh, Let me tell you that the weight loss is not the answer. The answer is health, real health. Weight loss is a side effect. Once you get the real health, your weight just melts away, completely melts away without any effort at all. So think about it as what happens when we are doing our regular practice. We are seeing so many patients with so many chronic diseases. And what are we trying to do? Uh, think about it like you are going on a busy road in Bombay with a number of eggs, and he's throwing eggs down on the people. Now you don't want people to get hurt, so you go and run and catch an egg. Then he throws another one, and you try to run and catch an egg. You can't. It goes down and breaks on the pavement or hits somebody. And so on, you go on running here and there, trying to catch all the eggs which are being thrown. Isn't that stupid? Why don't you go up and get hold of the guy who is throwing the eggs and stop him? It is as simple as that. So similarly, what we are doing today is we are trying to catch this disease, that problem, a fibroid there, or a heart disease there, or an arthritis there, or obesity there, diabetes. So many chronic diseases we are trying to catch by giving them symptomatic treatment. Why can't we go to the root cause of those diseases and cure those diseases by removing the root cause? Our healthcare system, right now, we call it a healthcare system. I would rather want to call it as a sick care system. We just let people get sick and then we take care of them. If it was really a healthcare system, we would have gone back and see that they maintain their health and they do not become sick at all. So let me give you an example. I'm just reading from my WhatsApp. This is a WhatsApp from a lady doctor at Indore who was interested in joining our program, maybe kind of just curious. And so she wrote to me that she is not willing to do this program because I'll read. I think I cannot quit dairy or wheat forever. I'm not having any big issue with my health. I do regular fitness activities plus meditation almost daily. My weight is 60 kgs. My age is 62. I remain active with whole day by God's grace. And I accept my age gracefully. This is what she wrote on WhatsApp 2 days back. I have invited her to attend this meeting. I'm not sure whether she has come. Now, from the look of it, it looks that the lady is very healthy, isn't it? But let me read what I replied to her. I asked her, what is your fasting insulin level? How do you know that you are not going towards insulin, this thing, resistance and down the line diabetes? What if you could increase your energy levels by at least twice? What if your skin and hair became more radiant? I also, almost all successful participants have started with that I can't live this or that. That is very normal and it is expected. But what we are going to take you through is very gentle, very empowering, and transformative. You can see the excitement in the eyes of everyone who discovered a new power inside them. And you can see the excitement in the eyes of Sunita ji also. Okay, so we teach you to retrain your mind. We teach you how to get out of addictions. When you were a high school student, eh, would you be declaring, I cannot do a LSCS? I cannot give injections to anyone. That was your belief at that time. But look how you have evolved now. All of you are doing LSCS, all of you are giving injection left, right, center. So come with us. Break free of all limiting beliefs, discover a new life. What I want is just a commitment of 3 months. And please attend the weekly meetings. That's all we need. That thing all. Leave everything to us. Because you know what? I have like gone through this myself. I had a triple vessel angioplasty done in 2006 when I was hardly 50 and less than 50 actually. So what was happening? I don't know. People said, oh, it is congenital, it is this thing. Indians have high coronary artery disease, it is stress and all that. What stupidity. Then I used to have swelling over the face all the time and I used to have gastroesophageal reflux. My sleep was absolutely horrible. Yes, I used to have medications every day for my acidity, for my insomnia, for this or that. And all medical investigations and tests were normal. Obviously, HDL was very low. HDL was below 30, but otherwise everything was normal. Finally, out of desperation, I found a health course which was run from Canada online, and I joined it in 2016. And in 3 months, everything got cured. Hey, I said, what is this? This is something that we as doctors, we don't know. So I started my own research, and then I found that there were so many answers. And based on that, I went on doing my research. I experimented so many protocols, and I have then started to work on my patients. Now, on my patients, I get very sick patients, cancer patients, hematology patients, purpura patients. I give them very little medicine. Let me tell you, if you see my prescriptions, you will have 2 or 3 drugs, not more, because I exactly want to do what is required. And apart from that, I tell them to change their diet. I want to tell them to remove this or that so that their disease process gets recovered. And we have been able to cure so many chronic diseases just by changing the diet. This is amazing. Deadly diseases. So, and then I thought I should train others also. And then we started this online program. Now we are running to the 3rd year, and maybe 5 batches we have done, right? So, thing is, you go back to again your great grandfathers. What used to happen? उस तरह कैसे रहे, कैसी रही उनकी जिंदगी, और वो कैसे उनकी डेथ हुई. So you will tell, most of the time you will understand that they were all right till a ripe old age, and then they died their natural death. अब क्या होता है? How did people die? How do people die? People die of cardiac disease, people die of stroke, people die of cancer, and people die of kidney disease. Now Alzheimer's is the new kid on the block, and so many things are happening. क्या change हो गया? What happened? Think about it. So that is what we have to find. These are all clues that somehow, somewhere we gone very, very wrong. And the only thing which has changed is our diet. And our diet is one which makes us. You take an apple and you eat that apple. So after some time, it will go into your mouth, then it will go into your stomach and intestine, and then it will dissolve and it will go away. So when did apple became Anil Singhvi? So there was a process when the apple stopped from being an apple but became Anil Singhvi. But the properties of the apple is going to be there in Anil Singhvi because apple made Anil Singhvi. Therefore, if you eat something which is bad, you are going to become bad. If you put kerosene into your car, how far is it going to run? Think about that. So the point is to be really, really understanding about what we are doing to ourselves, find out what is going wrong, and then go from there. Go from there. So what else? Now I've talked about motivational triad. Now this is very, very basic, and we teach this in our first 2 classes. That the motivational triad was programmed into us by nature. Consists of 3 parts. The 3 parts is, one is pleasure seeking. That means that when man used to live in the jungles, he was after pleasure, because pleasure was from what? Number one, food, so that he can survive. And number two, sex, so that he can procreate the species. So these are the 2 things nature programmed into us from the beginning. And that is into our DNA. That cannot go away. The other was pain avoidance. That means that when man didn't know what is happening, and if there's a fire, he's not going to go into the fire. If he eats something which is very, very bitter or which is poisonous, he will feel the pain, he'll not eat it. Again, survival. And the third thing was energy conservation. What do you mean by that? By that, we mean that when we want to run, we have energy. You see a tiger, he is sitting very आराम से बैठा रहता है. He's not doing anything. But when he is hungry, when he sees a prey, he runs like mad. And then he goes back into resting state. So that you can conserve your energy to make yourself survive, to find food and all that. ये 3 चीजें जो हैं हमारे डीएनए में प्रोग्राम करी गई, और वही 3 चीजें हमको पहले जब हम जंगल में रहते थे हमें सर्वाइवल की तरफ ले जाती थी. आज ये 3 चीजें हमारे पूरी की पूरी डाउनफॉल की तरफ ले जाती हैं. कंप्लीटली कंप्लीटली डाउनफॉल. सो नाउ थिंक अबाउट इट. आज हम प्लेजर सीकिंग करते हैं, मतलब क्या? हम जाते हैं, जो फास्ट फूड है वो खाते हैं, जो फूड अच्छा लगता है वो खाते हैं, जिसका टेस्ट अच्छा रहता है वो खाते हैं, जो एडिक्टिव है उसको खाते हैं, चॉकलेट खाते हैं, सब कुछ खाते हैं. हमारे पास पेन अवॉइडेंस है, तो हम क्या करते हैं कि हम हेल्दी फूड नहीं लेते, हम ग्रीन वेजिटेबल्स कम खाते हैं क्योंकि वो बहुत टेस्ट अच्छा नहीं लगता, एंड सो ऑन. एनर्जी कंजर्वेशन है, तो हम आराम से सोफे पे बैठ जाएंगे, एक बियर की बोतल ले लेंगे और चिप्स ले लेंगे और मूवी देखेंगे. या फिर कोक ले लेंगे, अगर आप बियर नहीं पीते तो कोक पियेंगे. तो ये है, ऑल दीज थिंग्स हैव बेसिकली लीडिंग टू योर डाउनफॉल. सो हम क्या करते हैं, इस कोर्स में इन तीनों चीजों का हैक करते हैं. इन तीनों चीज़ों को हम ब्रेक करते हैं और इन तीनों चीज़ों को फिर से हम अपने हेल्थ के लिए, अपने बेनिफिट के लिए एम्प्लॉय करते हैं। वहां से जब जाते हैं तो रिजल्ट्स ये मिलते हैं कि पीपल लूज ऑल देयर क्रेविंग्स, पीपल लूज ऑल देयर प्लेजर एक्टिविटीज फ्रॉम सो कॉल्ड एडिक्टिव फूड्स, एंड पीपल आर एडिक्टेड टू देयर हेल्थ, पीपल आर एडिक्टेड टू देयर एनर्जी। ये एनर्जी कहाँ से आती है? वो आज डांसर कहती है कि मैं आज मतलब नहीं खा के भी मैं 5-6 घंटे से ज्यादा 10 घंटे डांस कर लेती हूँ। कहाँ से आ रही है एनर्जी? थिंक अबाउट इट। आज हमारे शरीर पे जो फैट है, इफ यू डू योर बॉडी एनालिसिस, तो मैंने उसी लेडी को कहा कि आप बॉडी एनालिसिस करो, योर फैट लेवल शुड नॉट बी मोर देन 20% और 22%। मोस्ट ऑफ अस आर कैरिंग अ फैट लेवल ऑफ 40%, 45%, and we do that at the beginning of the course with everybody. So 45% fat तो बहुत ज्यादा है, and we have been carrying that fat with us from years and years and years and years. Now think about it कि एक ग्लूकोज के ग्राम में, एक कार्बोहाइड्रेट के ग्राम में कैलोरीज होती है 4 किलो कैलोरीज, एक फैट के ग्राम में 9 किलो कैलोरीज होती है, डबल द अमाउंट, मोर देन डबल द अमाउंट। सो नाउ if we could just learn how to burn the fat with the same ease as we burn the carbohydrate। लोग कहते हैं ना कि जिम जाना है तो आपको केला खा के जाना चाहिए, आपको मैराथन रेस करनी है तो केला खाना चाहिए, ये करना चाहिए, कार्बोहाइड्रेट खाना चाहिए। हम कहते हैं कि अगर हमने अपने बॉडी को टीच कर दिया कि वो जो हमारे अंदर जो फैट जमा है उस फैट को उठा के बर्न कर ले, उतने ही आराम से बर्न कर ले जिस तरह से कि वो कार्बोहाइड्रेट्स को बर्न करती है। And we are able to do that. By the second month of our course, we are able to do that. And that then becomes an unending source of energy inside you. आपके अंदर इतनी एनर्जी आ जाएगी बगैर खाए, क्योंकि वो आपका एनर्जी सोर्स है, वहां पे पड़ा हुआ है, फालतू पड़ा हुआ है ना? तो ये बिल्कुल इस तरह से हम कर सकते हैं, बिल्कुल। और जब ये करते हैं तो अब आपको सुनीता जी बताएंगे कि कैसा लगता है। हाँ, और डेफिनेटली यू शुड लिसन टू हर इन डिटेल अबाउट व्हाट शी फील्स राइट नाउ, कि कैसा होता है। So let us now talk about satiety. That's the last thing going to talk about 5 minutes. आपने देखा कि हमारे साथ सबके साथ वेट की बड़ी प्रॉब्लम है, लेकिन आप जानवरों को देखो, आप पक्षियों को देखो। हाँ, कोई भी पक्षी, कोई भी आप देखा है कि वो इतनी इतनी ओवरवेट है कि उड़ नहीं सकती, या उतनी अंडरवेट है कि उसमें बिल्कुल एनर्जी नहीं है? नहीं, दे आर परफेक्ट, दे आर परफेक्ट। बट वो एक चिंपांजी को देखो जो कि बहुत क्लोज है आदमी से। तो चिंपांजी का वजन मान लो 70 kg है, 80 kg है, अब हेवी भी होते हैं 100 kg है। वो केले हैं, उसके पास खाने को बहुत सारी चीजें हैं, लेकिन वो उतना ही खाता है जितना कि उसका बॉडी वेट उसको मेंटेन करना रहता है। अगर वो उसने 1% भी ज्यादा खाना खाया तो ओवर ए पीरियड ऑफ 20 years he will put on 80 kgs weight। ऐसा होता नहीं है। अगर उसने 1% कम खाया तो ओवर ए पीरियड ऑफ 20 years he will go down by 80 kgs। नहीं होता, उसका वेट स्टैग्नेट रहता है, परफेक्ट रहता है। these people, these animals can maintain their perfect weight without any education at all। बिल्कुल। और उसके लिए क्या किया जाए? तो हम लोग क्या करते हैं कि हम लोग नहीं कर पाते, हमें जाना पड़ता है डाइटिशियन के पास, हमें जाना पड़ता है जिम में जाना पड़ता है, हमें डॉक्टर्स के पास जाना पड़ता है, फिर भी हमारा काम नहीं होता। हम लोग कहाँ गलती कर रहे हैं जो कि जानवर नहीं कर रहे हैं? थिंक अबाउट इट, सोचने की बात है। ये सारे आंसर्स आपको अगर मिल जाते हैं तो चीज, लाइफ बदल जाती है, लाइफ बदल जाती है। मेरा कहना यह है, जो मैंने उस मैडम से भी कहा, कि यू हैव द राइट टू हेल्थ, you have the right at the age of 60 to feel as though you were 30। You have the right to have as much energy as you want till the time you die। और मैं खैर वो, मैं उनको बहुत ज्यादा जानता नहीं था, लेकिन मैं जानता तो मैं उनसे कहता, यू हैव द राइट टू लुक सेक्सी एट द एज ऑफ 60। कम ऑन, सवाल ही नहीं है, सवाल ही नहीं है। दिस इज योर बर्थ राइट। आप नहीं दिखोगे तो कौन दिखेगा? एंड दैट इज वेर वी टीच पीपल। भी हम कहते हैं ये तुम्हारे मोटिव, ये तुम्हारे टारगेट्स हैं, ये लिखो कागज पे, सामने दीवार पे लगा दो, एक एक करके टिक करते जाओ। 3 महीने में अगर तुम्हारे हर एक टारगेट टिक नहीं हुए तो हमको बताना। कुछ भी नहीं करना है, सिंपल है। 1 घंटा देना है हफ्ते में। बट द थिंग इज कि यू हैव टू नो हाउ, एंड you have to be motivated enough to change and give yourself 3 months. So with that, I think I will first invite Sunita ji to describe her experience, which she just finished, and then I'll take questions. Yeah. बोलिए सुनीता जी.
Good morning, everybody, again, once again. And I'm really happy here to introduce to you Dr. Anil Singhvi, sir, because he is the man behind transforming our lives. सबसे पहले तो हम थैंक यू बोलेंगे डॉक्टर पूर्णिमा सुबेदार मैम का, बिकॉज ऑफ हर आई गॉट टू नो डॉक्टर सिंघवी. एंड बिफोर नोइंग सिंघवी सर, आई वॉज ऑलवेज अ फिटनेस फ्रीक सर. आई मीन हम जब से हमने होश संभाला, मैं क्या थे, जब से आई गॉट टू अंडरस्टैंड कि व्हाट इज लाइफ, उस समय से आई वॉज ऑलवेज वांटिंग टू बी फिट. एंड आई ट्राइड एवरीथिंग. हम साइकिलिंग करते थे, हम स्विमिंग करते थे, आई यूज टू डू एरोबिक्स, जिमिंग, everything, every possible thing I have tried, crash dieting, everything. लेकिन since the time I got married, 52 kg से हमने शुरू किया, and it was the rule कि 1 kg to 2 kg every year बढ़ना है, no matter what you are doing. And हमारा ambition was only losing weight. And कभी अगर एक आध बार lose कर भी लिया weight, तो it was always very painful. या तो हम vigorous exercises कर रहे थे, या हम क्रैश डाइट्स कर रहे थे, एंड इट वाज रियली नॉट हैपनिंग. वो परसिस्टेंस नहीं था. बट आफ्टर मीटिंग सर, एक्चुअली वी गॉट टू नो कि व्हाट actually transforming life is. It was like in this 3 months, we have lost not less than 10 to 12 kg, both of us. And every day, अब हम लोग थक गए हैं कॉम्प्लीमेंट्स ले लेके. Every day, wherever we are going, people, I mean, ऐसा लगता है अब बस अब कुछ और बात करते हैं kinds of. लेकिन they'll keep on asking you, हाँ आपने बात चेंज भी कर लिया, then also they'll keep on asking you, हुआ कैसे? आई मीन तुम लोग इतना छोटे कैसे दिख रहे हो दोनों? आई मीन एज इफ वी आर सीइंग यू 20 years पुरानी वाली डॉक्टर सुनीता या डॉक्टर नीलेश. एंड दैट हैज रियली, आई मीन दैट वाज एज सून एज आई गॉट टू टॉक टू डॉक्टर पैम, हम सर को द नेक्स्ट फोन आई डिड वाज सर, क्योंकि आई थॉट वेलनेस हैज नथिंग टू डू मोर देन व्हाट ही टॉट अस. एंड आफ्टर दिस प्रोग्राम सर, हम लोग ने वी लॉस्ट वेट, we lost, I mean, like, we knew what happiness actually is. Or during this process, the only thing, the best part of this process was we never starved, we never had crash dietings, we never had vigorous exercises. He taught us how to think right, how to eat right, and more than that, he also taught us to meditate and stay cool at mind. And I mean, like, I mean, I don't have words to thank sir enough for what he has given a new picture of life altogether. Now, I mean, हम लोग का कोर्स कंप्लीट हो गया है, लेकिन वी नो कि हमको क्या खाना है, कितना खाना है, कब खाना है. And that is all the, I mean, actually, that is the principle of living healthy is. Thank you once again, Dr. Anil Singhvi, sir, for being there for us. And I mean, being here and removing time from your busy schedule and on this Sunday morning.
Thank you, Sunita ji. It was really fantastic to have you people on the course. And for those of you, just I'm giving you the information, we are starting a new group on 6th of January. We still have some seats left. If anybody wants you to join, please contact me directly.
You suggest for diet in the PCOS patients?
Yes, diet in the
PCOS, polycystic ovarian syndrome.
Yes. I was actually trying to cover that in my talk, but there was no time. I was thinking, say, what is happening is वो हम जो eggs फेंक रहा है ना, उसमें एक PCOD भी है. अब PCOD is a huge issue और हमारे पास उसका कोई अच्छा आंसर नहीं है. तो I think it is very important to remove all the causative agents for PCOD. One is obviously obesity, other is hormonal imbalance. I mean, now we have been able to reverse hypothyroidism. I mean, can you believe that? I didn't believe that. But in my latest group, we had people who were hypothyroid for 20 years और उनका hypothyroidism कम हो गया. Because thyroid gets destroyed by
हम लोग के
immune.
ग्रुप, हाँ, हम
हाँ
लोग के ग्रुप
बताइए
में
एक
बहुत
एक
सारे लोग थे जो डायबिटिक थे, एंड वो उन लोग का शुगर लेवल केम टू नॉर्मल, एंड दे हैड, आई मीन, इंसुलिन उनका बंद हो गया, शुगर टैबलेट्स बंद हो गई, एंड ड्यूरिंग दैट, एंड देयर वाज नो स्टार्विंग इनटू इट.
तो बेसिकली मेरा कहना यह है कि हम अगर उसके सारे बॉडी सिस्टम्स को नॉर्मल कर दें, उनका फैट लेवल नीचे ले आए, पीसीओडी में बहुत
I'd
फर्क
like to
आएगा.
ask a question. Sir, how do you deal
So if there are
with
no other questions, I will.
Sir, I'm asking a question. Yeah. Sir, how do you deal with depression and keeping fit in your course? Because as I think somebody had mentioned, gynecologists are prone to depression. Each one of them has gone through multiple cycles of depression in their life, personal reasons, professional reasons, and all. So in your program, how do you integrate something to take care of the
Yes,
depression? Because that adds to his
absolutely.
health. Yeah.
See, you cannot transform when you are depressed. 100%. You're right. Absolutely. हमारे प्रोग्राम में हमने क्या किया है? Now we have incorporated meditation techniques, which we start from third week now. Very simple meditation, 15 minutes. Your all depression is gone. Then we also going to take you to 2 sessions of hypnosis. तो hypnosis होगी और उसमें आपके सारे negative thoughts clear करे जाएंगे. And the diet transformation process itself leads to amazing changes. हमारे पास patients आए हैं who have been on schizophrenic drugs and they have been gone off drugs after doing this 3-month program. So depression तो amazing है, मतलब 100% guarantee है कि चला जाएगा.
Okay. Thank you.
Sir, I have a question, sir. If a
Yes.
patient is menopausal and is a patient of hypothyroidism, and she has been treated for breast carcinoma, she has insulin resistance and obesity, what diet would you suggest?
Oh, this is the whole thing. The whole transformative thing has to happen, that she has to go back to all the principles that we follow, है ना? तो इसमें सारे के सारी जो हम लोग बेसलाइन लेवल से पूरा चेंज करते हैं. Most important thing, again, I did not have time to tell you, was to we reboot the gut microbiome. The gut microbiome is extremely important because it regulates every single important function in the body. Immune function, metabolic function, brain function, ये सारी की सारी चीजें को वो गट माइक्रोबायोम कम तो करता है. तो अगर हमने गट माइक्रोबायोम को ठीक कर दिया तो आपका डिप्रेशन चला जाता है, आपका क्रेविंग्स चली जाती है, आपका फैट लूज होने लगता है और ब्रेन फंक्शन अमेजिंग हो जाता है. और वो सब चीज सुनीता जी के साथ हुआ और जितने भी लोग हैं उन लोगों के साथ हुआ है. तो आई गेस कैन नॉट गिव
How
यू
do you
वन
correct
लाइन
that?
आंसर. We change everything in the diet slowly. मतलब एक ही आंसर नहीं, उसके 20 आंसर्स हैं. तो
Okay,
ये
thank
है.
you, sir.
या
सर how to join sir?
you
आपको
just
कैसे
you
join
just you
किया जा
just give
सकता
me
है?
you just give me a call. फोन कर लो मेरे को 9425066266.
So sweet of you, sir. Thank you, sir. Sir, I'll be your next student, sir.